build cloud-based technology on patient engagement for improving health outcomes in the diabetes community. So Joe is going to explain why this is game-changing for clinical trials, and he will be joined via Skype, I love the cool technology, by one of his partners. Joe.
Thank you. Lord Kelvin said, if you cannot measure it, you cannot improve it. So in the modern era of clinical trials, this is how we've released new drugs and new therapies to the market. We conduct phased experiments on humans, and after enough measurements, we find out if we have improved the human condition. For over 100 years, this data collection was typically done on paper and in the office of a physician or a researcher. Today, medidata, our clinical cloud software, and this is a real number, is collecting over 50% of the online data collected in clinical trials around the world. So to disrupt this process even further, we built an app to connect the world of quantified self-devices to the world of clinical trials. Let me show you how it works by introducing via satellite Brock Heinz, who is one of our partners at Medidata working for Spalding Clinical Research. Brock.
So in addition to being Brock Heinz, I am also subject 1012, and I'm participating in a clinical trial in the future, as you can see in the comfort of my own home office. As part of this trial, the investigators provided me with a Withings Pulse activity tracker, a Withings scale, and a 12-lead mHealth Spalding electrocardiograph that allows me to very rapidly attach 12 leads to my chest and acquire a diagnostic quality ECG. My participation in this trial consists of about 5 minutes of time each morning, where my data is passively and automatically transmitted via my mobile phone to the study investigator via the metadata rave system. This level of engagement is something that I'm happy to do and is not at all a burden on the everyday process of my normal life.
Okay. Log in here. So what we have is this actual software that Spalding Clinical built alongside Medidata. So their software actually aggregates all of the tracker data and takes this information and allows a single patient through an interface, whether it's the patient themselves or their doctors or physicians, to actually integrate the quantified self devices like the Fitbits, the Withings, the Nike Fuel Bands, use the APIs that already exist, aggregate the data, identify trends, and then move them into a clinical trials system, which is much different than what people have been seeing here today. Most of them go into EMRs or personal health records. Medidata Rave is the actual clinical trial system that is being used in over in a lot of the clinical trials around the world. What I believe can enhance this future is the addition of the quantified self devices to monitor subjects more frequently as they live their daily lives. The real innovation here is not the user interface, but it's building the bridge into the clinical trial world and figuring out how to use it. Capturing this passive data may give us a window into the condition that we were not aware of before, but also reduce the amount of in-clinic visits and procedures required in a study protocol. By pushing these things that were once required in a doctor's office down into the patient's home, we're able to identify trends about how real people live their lives with a certain medical condition, or when taking a specific drug under investigation in a clinical trial. Medidata is putting some skin in the game. So we are announcing our first sponsorship of our own clinical trial in coordination with Dr. Zach Bloomgarden out of Mount Sinai to identify and prove the effectiveness of this whole concept using activity trackers in diabetes, right? So when quantified self apps are added to a clinical platform in the cloud, automatic feeds of new data can be put into a patient's profile. This is a case report form, part of a full clinical trial system that this data are coming into. We want to further use this technology to help conducting research more effective and make decisions better to drive new drugs to market faster and finally converge the world of healthcare and research. Thank you. Thank you, Rob.
In case people have questions. No, seriously.
I'll let you stay on, Rob. I'll just move your window.
So while we're getting set up, I'm going to introduce our third speaker. And if we're going a little quickly here, it's because we want